Hi everyone, I'm Dr. Lynn Wagner, and today's episode is about skincare. So I have a lot of patients ask me, and it's usually at the last 30 seconds of their appointment, what do you do for your skin? How does it look so good? And so I try to tell them, and I figured I would make a video to tell everyone what I do so they can kind of see how I use products and how they might want to use products on their own. So disclaimer here, I grew up in a household where my mom sold Mary Kay Cosmetics and I was anti-makeup and anti-skincare. So for most of my childhood and teen years, she was fighting with me to take better care of my skin and I just did not care at all. And then obviously a woman gets into her 40s and she starts to think, well, maybe I should start to take care of my skin better. It was literally the first time in my life that I thought about maybe taking better care of my skin. I wish I had done it earlier. And at that point in my life, I had my integrative medicine practice, and we actually had some aesthetic procedures happening in the office. So it was very natural to start carrying products and also using them myself. And so I'm going to tell you what I do, and then in a separate video, I'm going to tell you more about the procedures I've done, which are very minimal, but those people have questions about those as well. But for the sake of today's video, we're just going to talk about products. So what I used to do was wash my face with a bar of soap. And then use Cetaphil and CeraVe. So Cetaphil, I used the gentle wash, and then the CeraVe, I just use their regular lotion. And that works fine. And I tell people when I'm walking through products with them, if you want to swap something out for price, or you want something that you can get at the local pharmacy, those types of brands can be really good. So like CeraVe, Cetaphil, but you're not going to get that next level of skincare that you're going to get with a professional product. And so I've been very, very happy myself after having switched to these products, and I'm going to share them with you. So let's talk about the morning. So first thing in the morning when I get up, after I do all my stuff and I'm finally going to take my shower, a lot of times I'll just rinse my face in the shower because I've already done the cleansing and everything the night before. But sometimes I still will use that bar of soap. Let's say I feel like I have a little bit of makeup left over, or I didn't wash my face the night before, or I had a workout and I want to get the sweat off. So I still use a little bar of soap. I use a natural bar of soap in the shower. That's my guilty pleasure there. And then after that, I start using better products. So I have a very methodical way of doing this. So when I get out of the shower, I don't like to towel off too much because if you think about it, when your skin is damp, it's going to absorb products better. And so I might lightly dab some of the bigger drops of water off my face and my skin, but very, very minimally. So I'm pretty wet when I'm putting my products on, but just not big drops of wetness. I'm just very moist. So the first thing I do is we have this Everactive C and peptide. So this is a vitamin C serum, and vitamin C is a very powerful antioxidant, which is very, very important for all of the free radicals that our skin gets exposed to throughout the day. So this is going to be very protective. It can be brightening and make your skin look more youthful. So I do one pump of this, and it comes in a little brown bottle to keep it from getting oxidized from sunlight. I do one pump of that every morning, first thing right out of the shower. So I let that sit. And then so it has some time to activate, I move on to the body. So then I do my body, and I found this brand at a local store up in Door County, and I fell in love with it. I've tried so many oils, I've tried so many lotions, and this oil just soaks into your skin. It doesn't leave any greasy residue, and you don't get any of that dry, scaly look on your skin. So it's absolutely wonderful. This I find really, really important, that your skin is moist. So if I towel off too much or if I get distracted, then it seems to not soak in as well. So you really want to do this right out of the shower when your skin is still pretty wet. And I use one pump on each arm, and then I use one pump on each leg, and then I take the rest of it and spread it wherever else I need it. And I absolutely love it. I'm addicted to this stuff. My kids use it. I have it all over the place. So that's the body. And then by that time, I feel like the vitamin C serum has settled on my face. And so then I just moisturize, and that's all I do. So it depends on the time of year. I have kind of dry skin. I'm a little bit older. So in the summer, when it's more humid in Wisconsin, I'll use Hydra Dew, which is a lighter lotion. So it's not going to feel as thick. And that works great for me in the summer months, or if I travel in the winter. And then the rest of the year, I use a Hydra Rich, which is a little bit thicker, but in the winter when my skin is drier, this works very, very well. The nice thing I love about these products is when I use it, I literally just need one pump and it spreads really well. So you're not going through it very fast. Like my bottles last me a very, very long time. And then I do my makeup routine and that's it. So that's my skincare regimen for the morning. Some people will also add in a sunscreen. So if I'm going to be out in the sun a lot, then I obviously will definitely put on a sunscreen, but I do not use a sunscreen every day, which the esthetician here and the injectors here are probably horrified by that, but I personally don't use the sunscreen every day, but it's probably a good idea to do so. So then I have my day. And as you know, days are stressful. We're exposed to all sorts of things in the air. And so nighttime routine is really, really important. So what I do for nighttime is also pretty simple, but I use more products. And I think the older you get, the more products you'll use, but people can even start using these products in their younger years as well. I didn't, I should have, but that's behind. So the first thing I do is cleanse my face. And I also have a pretty specific ritual for cleansing my face. So I use this product called Hydra Boost. It's a creamy cleanser. I found that anything that's gel based or more liquidy dries me out too much. So I like a creamy cleanser. And I rub it all over my face. And then I got really sick of splashing my face and trying to get it off with splashing. So I literally turn on the faucet, put it at the right temperature, and I just stick my face under the water and I rub it like this. And so I get all of the product off. I love it. And then I usually also have a washcloth, and we also have these disposable cloths here if you're worried about contamination of your washcloths, but I use a fresh washcloth every day, and I get it really warm, really saturated, wring it out, and then I just put it on my face, let it sit for a few seconds, and then I just gently rub off any extra residue. And that works really, really well. Then after that, I have two different things I do. So every other day I alternate. So on one day I use Skin Better's exfoliating peel pads. So these have glycolic, lactic, and salicylic formulation. So they're going to do more exfoliating. On the days that I use these, I do not use a retinol product because I think it's too much. My skin would dry out. And so I just use this. And it's kind of cool because you use it and you think that you washed your face so well, and there's always more product on there from my makeup from the day. So I feel like I'm just getting my skin extra clean by using these and just kind of getting rid of dead skin and things that kind of clump your makeup when you're trying to put your makeup on the next day. On the alternate days when I'm doing a retinol product, I'll use anywhere from a 0.5 to a 1.0 retinol product. So I love retinol. If I use it every day, it's too drying. So every other day I'll do a retinol. Before I place the retinol on my face, I use this bright and clear solution, which is like a toner. And it does the same thing as those pads where I feel like it takes off any extra makeup and just kind of removes some of the excess debris on my face. So that when you use the retinol product, you're getting all of it on your skin and it's not kind of clumping with dead skin cells and things that you don't really care about. So that's next. And then after that, will always go back and grab the moisturizer that I use, whether it's the Hydra Rich or Hydra Dew, and just put a light layer of that on my face. Sometimes I skip that, but most nights I'll put some type of moisturizer on my face after that. And then once a week, this is an important point because even when I do all of these products, I'll find after about a week, I'll put my makeup on in the morning and I can see just some clumping in my chin or, dry spots on my cheek. And no one likes that, right? So I will once a week do a peel. So this is an enzymatic peel and you apply it to your face for about 2 to 3 minutes. You can kind of feel some tingling. So it is strong. You avoid your eyes and then I wipe it off and it just kind of does a deep removal of all of those dead skin cells so that the makeup doesn't clump so much. So that's honestly it, you guys. It seems like a lot. And I would say my morning routine takes 30 seconds, maybe a minute. And my nighttime routine probably takes about a minute to a minute and a half. Things that you're going to probably ask questions about, like, where's your eye cream? There's so many other products you can use, but I'm kind of a simple person. And this amount of stuff I can do beyond that, I find that it makes me feel cluttered and there's too much to do. And then I just throw the towel out and don't do any of it. So this is the routine that works really well for me. Two other things I would say that I don't have laying out here is I also do use one of those lash extenders. So there's Latisse, which is more of a medicine. And then there's Grande Lash, which is more natural. So I actually put a Grande Lash serum on my upper eyelids and then on my eyebrows because I have really thin eyebrows. I do that most nights as well, just to kind of keep a little bit of length to my short little eyelashes and a little bit of more fullness to my brows. And my brows are also blonde, so I like to have as much volume there as I can. That works really well. And then lastly, throughout the day, the same company that makes that body oil makes an amazing, delicious hand lotion. So I have these in my car. I have it at home. I have it at work. And so throughout the day, I'm taking a little dab of this. It's very similar to the oil in that you don't get that sticky residue. So if I'm on my computer, I'm not leaving greasy marks on my computer. If I'm touching papers, I'm not leaving grease marks on the papers. If I'm shaking a patient's hand, they're not going to walk away from me and be like, ew, that's disgusting. So I really, really love this. And then I also kind of mix that in with Aquaphor. So Aquaphor is a petroleum-based Walgreens pharmacy brand, really thick hand lotion. So in the winter when things are really, really rough, like at nighttime before I go to bed, I'll do a really thick layer of Aquaphor on my hands and sometimes my feet and my elbows, just to take care of those dry spots. So I hope that helped. I'm going to share this with every patient who asks me what I do, because I found it to be very helpful for myself, and I'm very happy that I started taking care of my skin. I've noticed a nice difference, and I think you will too. So let me know if you have any questions, and I will talk to you again soon.